Hello, in Module 4, we will be discussing goals for our plan of care. Goals must be member stated. They must be wellness and recovery goals, including targeted timeframes for attaining those goals, strategies for how the desired goals will be achieved, actions describing how goals will be achieved, supports both paid and unpaid, and how they are needed to achieve the desired goals. And they should define who will assist the member with the achievement of these goals. Specifically for children and youth enrolled in Children's Health Home, for youth 14 and older, they must have a goal in their plan of care related to developing the member's capacity to live independently one day and the identification of those resources to help the member achieve independence in the future. Then specifically for our youth that are 17 and older, the plan of care must also include a transition plan to adult services and the identification of those resources. Things to keep in mind when developing goals. You want to make sure that you understand the services that are available in your area to your member. You want to make sure that goal writing is a collaborative process. We're not writing goals for our members, we're writing goals with our members. Understand that goals should change and evolve over time. As you work with a member, you should be achieving goals, completing goals, and then amending those goals and adding new ones at every amendment, every 6 months to a year. And the goals should not be too broad or too overwhelming. Goals can be broken down into the following different domains. So that would be interests, wants, needs, personal circumstances, and personal assistance. Next, we're going to discuss SMART goals and writing SMART goals for goal setting. SMART goals are specific, measurable, achievable, realistic, and timely. So when you write a goal, you want to make sure that the goal is specific. What specific task do you need to accomplish or behavior do you need to improve? You want to make sure that it's measurable. You want to make sure that it's clear when that goal has been completed or accomplished. You want to make sure that it's achievable. If a member would like to become an astronaut, you're not going to start with that as your beginning goal, but you're going to take tiny steps to achieve that overarching goal. And you want to make sure that the goals are realistic to the member, and you want to meet the member where they're at and what they're able to work on and what they're willing to work on. And lastly, you want to make sure that the goals are timely. That you will do right in the plan of care. You will have to pick a target date to complete the goals by. But you do want to make sure that they are able to complete it within a timely manner. Goal statements. The plan of care should reflect the objectives and interventions associated with the member's overall goal statement and SMART goals that will be implemented. So the client goal statement should be developed directly with the member in mind. It should be in their own words. It is what they would like to work on during their time in health home. We also like to include in the goal statement what successful graduation from health home would look like. You can also put that right in your goal statement. And then below that, you're going to have your client strengths and your client barriers. This can be pulled from the CANS, your comprehensive assessment, or any other supporting documentation that you have from the member, or directly from member self-report. The goal comment section of the plan of care should be person-centered, overall goal that the member would like to achieve. This would reflect what they would like the health home care manager to help them accomplish in order to successfully graduate from the program. So your client goal statement is the most important element in your plan of care.